Well, 2025 is like right around the corner, like literally right around the corner.
Oh my gosh.
You know, I mean, I'm excited. I think there's huge opportunity on the horizon in 2025. I mean, you've really dug deep into this. What are you seeing?
We have 4 girls, and when the older 2 were little kids and I was driving them to school, because we had a little gap between them, I would talk about work a lot of times. They'd ask me questions about work, and I'd talk to them about work, and they said, well, you work a lot, Dad. What are you doing? And this is when we had the clinic in Pennsylvania. And I said, well, I'm trying to change healthcare. Well, when's that going to happen? And I remember my answer being like, well, not in our lifetime. Well, why not? Because there's so much work to do. It'd probably never be overcome. Well, that was 30 years ago. And
I remember
a lot has happened in 30 years. And a lot has happened in the last year. And a lot has happened in the last month. So without getting political, we've had an election. We have a new president, and he's picking a director of health and human services. And he happened to pick somebody who was from the opposite party, but the guy had very refreshing new ideas that align very much with the chiropractic profession. This is Bobby Kennedy Jr.
Yep.
And Bobby Kennedy is like a breath of fresh air. I mean, he's talking about things that we've talked about for 30 and 40 years that were wrong. Like some of the things that were put in our food, and America was led to believe it was very safe when it really wasn't. Our food source is horrible. And if you look at the statistics on it, when you and I were kids in the 60s and 70s, chronic degenerative disease was 1% of the population.
Yeah.
And now it's 66% of the population.
That's crazy. That's just crazy.
Ooh, the crazier stat.
Same with allergies.
Yeah.
Like, we went to school, I don't know. I rarely knew any child with a peanut allergy. It just didn't really exist.
Yeah, it didn't exist. But that all came from genetic modifying of foods, which has been approved over the last 30 and 40 years, 50 years, if we look back that far. So, you know, you look at that and you go, how did all this come about? And so many private interests got involved, and the government got involved. And I'm sorry, I don't care what party you're from. The bigger the government gets, the worse the country gets. That's just my viewpoint on it. My outside viewpoint on it is because there's people that are not running a business. They don't have to be accountable. And if you're running a business, I mean, you know how hard that is. Our clients know how hard that is. It's hard to run a business. It's really hard. And when you learn how to do it, you have to really work at getting yourself better and better and better. I'm sorry, but I don't see a lot of government employees taking self-help courses to do better at their job.
Yeah.
What I see is a lot of people putting their hand in the till and making things like, you know, having a hammer for a contractor for the government be a $5,000 hammer, or a toilet seat be a $35,000 toilet.
I think a lot of that is also going to go away. But, you know, back to that food source thing, the American food source has been polluted. Totally polluted.
Completely.
I think we were talking about, I don't remember which food has, Fruit Loops in Canada has 5 ingredients, and the United States has how much?
16.
16 ingredients, and they're all extra like chemicals is what they are.
Because it's approved by the FDA.
Yeah.
And then, you know, there's a fast food chain that I don't want to mention who they are, but they put an ingredient in their bread to make it very soft, which is actually an insulation foam. It's not even food, and it's banned in every country.
Except the United States. Except for that soft bread, whatever they're feeding us.
That's it. So yeah,
I know.
that insulation tastes great.
For our industry, I see the opportunity is there's going to be more public awareness that the healthcare system that was so trusted in the past should be questioned. And that's a huge opportunity for us because we've always, chiropractors and these types of clinics, the integrated clinics, have always been on the outskirts of what would be norms. And I think what Bobby Kennedy's going to do is he's going to expose some of these things that everybody just took for granted as normal and go, oh, well, I trusted this, so they're going to look someplace else.
Here's why I'm excited the most. The stats are so bad that for the first time they can honestly say, I'm sorry, when the establishment says, no, you can't pick them, they're not really blah, blah, blah. Chiropractors are not real doctors. We're at the point where they go, you guys have had your shot, and now 2 out of every 3 children will be disqualified from the military because they're either fat or they were taking drugs that made them labeled as a psych patient and can never carry a firearm, like attention deficit drugs, Ritalin and ADD, ADHD.
That's a lot of the population.
2/3 of the population are disqualified from being in the military. That is like,
that's totally.
I never thought I'd see that in my lifetime.
No.
So now, for the first time, America's going, well, who else can help us? And I'm telling you, we could bitch about the stats all day long, but the only thing that's going to resonate right now is solutions.
Yeah.
So having solutions, we have a solution in place for pain, and it's not opioids. I mean, like to have 100,000, 150,000 people dying a year from opioid overdose.
Now, our clients' offices are poised to be the solution on the ground.
Medical clinics that work with very non-invasive. I mean, this was my vision my whole career. How do you get chiropractic, a non-invasive, non-dangerous, very effective treatment, be part of traditional healthcare? Right now, Bobby Kennedy is looking at that. I know that there's at least 3 chiropractors going to be appointed to Health and Human Services.
There was none.
Yeah, there was never any.
Yeah.
And we're talking about a fund for alternative and complementary medicine that every year was taken away by traditional medicine because we were looking at turmeric. Will now be going to the largest alternative there is, which never got a penny, and that's chiropractic.
Yep.
We are and have been for the last 40 years.
I'm telling you,
the largest alternative.
It is poised. This next year, 2025, is poised for this, which means the opportunity for integration, opportunity for chiropractic, there's no question, is absolutely there. But to put chiropractic in with the medical profession, you put them in the same office, huge opportunity, because you have to imagine 90% of the population who've just been drilled into them, don't go to a chiropractor. It's just been drilled into them, right? They're going to see something different, but they still might not be sure. So these integrated offices where there's medical provider and a chiropractor in there, it's like literally, it's that this is an opportunity of a lifetime.
As a marketer, I always tried to look in a business person because my undergrad degree is in marketing, and I worked for Reuben Donnelly, which is owned by Dun & Bradstreet. So I've often envisioned if chiropractic took over, how would that take place? And there would be some sort of a simulation but we'd have to keep our ethics and our integrity so that we didn't just become another group that prescribes drugs.
Right.
And we've done well at that, but what we've not done well at is fighting with each other. We all fight, oh, I got my technique, that takes better than this technique. Oh, no, I can't believe in that, I can't do that. I don't even want to work with a medical person.
Yeah, it is time for the chiropractors to unite.
We need to assimilate. We need to work together.
You guys need to work together.
And have people pure of heart, both medical and chiropractic, working together. They'll be open-minded enough to realize, you know what, the drugs weren't working very good. Let's try this other stuff first.
Yeah.
Oh, there's some things like regenerative medicine. There's, Tramiel and Serapin are very safe drugs that have been around with no side effects. Yes, we should be using them instead of putting them on an opioid, which has a 33% chance of addicting them in the first week.
Yeah. But take it back to, I want to talk about reuniting the chiropractic community. There's a huge opportunity for chiropractic in 2025.
Yep.
And the opportunity is there with a united front.
Yep.
If the patients start coming in and there's a mixed message across the board, that's not going to be good for the chiropractic field. The field is like ripe right now for the very big players in the chiropractic field to unite the field. And we know, and we can't really talk about it too deep, but we know because we're part of it behind the scenes of some of the big players starting to come to the table to say, okay, how can we, this is for the first time, how old is chiropractic? 125 years old?
130 years.
It's been 140 years.
1895.
So 130, whatever it's been, there's now an opportunity now. It takes the responsibility of the chiropractors to accept that responsibility, to accept it, the opportunity.
Yeah. So.
And what does that mean for these integrated offices? Is a good year for 2025.
And it's to our country's survival and benefit for them to grow their practice and be successful. This is not thinking like I want to be richer. That money's going to be shifted. You need to grow your practice big enough to get enough people in there going, I demand this type of care. And then the government will say, okay, insurance companies, why don't you cover this type of care? Why do you give a $5 coverage on a $55 or $60 treatment because there's a $55 copay? And then you can advertise, oh, we have a little bit of chiropractic. I mean, that's just a ploy to make it look like you cover the alternative when you don't. So for the first time in my whole career, I actually believed this could happen in the next 4 years.
Absolutely,
so, I am very, very optimistic about the future. We just need to get our butts in gear and build our practices so we have something to deliver when these people start going, where's the alternative?
Exactly.
And that will be us.